Okay, so you have 18 questions total. You have 10 seconds to answer each question, and after the 10 seconds are up, you'll switch to the screen with the actual answer. Okay? All right, let's get started. Question number one. This supply is used to measure urine in the measuring and recording urinary output scale. We have option A, urinal, B, beaker, or C, urometer. And the correct answer is B, beaker. So this is what a beaker looks like. This is about the average size that you'll see in a facility. As you see, there's a lot of urine in this container, so it can be more, it can be less. Just depends on how full this person's bladder was and how well everything is working. The urine should be light yellow, straw-colored yellow. It shouldn't be too clear, and it definitely shouldn't be dark and foul-smelling. But whatever it looks like, just make sure you report to the nurse and just her urine looks good, it was clear yellow, or her urine had a really foul smell, you might want to go in and check it out. When you're doing your skill, just make sure that you are using the cc's, which is cubic centimeters, or ml for milliliters when we're measuring. We never use ounces. Some of these containers actually have two sections. One section will literally say cc and the other section will say ounces. So just make sure that you are not using the side that says ounces. And sometimes these containers are not super clear like this. Sometimes they're more of a thick plastic. I personally prefer the clear one. Just easier to see the contents and what they look like, as well as the measurements. So this is your beaker. Again, we use cc's. We never use ounces. Okay. Question number two. What is the name of this supply? We have A, fracture pan, B, commode, or C, bedpan. So the correct answer is C, bedpan. As you see, the bedpan has a wide side and a narrow side. The wide side always goes up towards the head, and the narrow goes towards the feet. So I always say wide is hips, and then skinny or feet. So whenever you're putting this bedpan under somebody, just make sure that you have the wide side facing the head and the narrow parts that kind of curves up a little bit facing the knees. So in bedpan, the difference between a bedpan and a fracture pan is a fracture pan is shaped a little different and it's a little smaller. Fracture pan is usually used for someone who's had some kind of a surgery, maybe hip surgery or back surgery, and then they're not able to bend their knees and lift their hips. So we have to roll them over on the side, put the fracture pan against their body, and then roll them back over. The bed pan, you can do that, but you can also have the person to bend their knees, lift their hips. You slide the bed pan under, and then they relax their hips back on top of the bedpan. So the bedpan can actually be used in the same manner as a fracture pan, or we can bend their knees and lift their hips. Just kind of depends on the resident and their mobility, what they're able to, what they're able to, not able to do. The commode is just a portable toilet that you can put beside a person's bed. So those are your three options, and the correct answer was bedpan. Question number three. This supply is used in which two skills? So it's going to be two answers here. We have three options, and two answers are going to be correct. So we have A, urinary output, B, hairy care, or C, assists with bedpan. So your two correct answers are A, measuring and recording urinary output, and C, assist with bedpan. So of course the supply is the bedpan. And so you have to use the bedpan for two of your skills, two of your CNA skills. Okay. Question number four. This supply is used for which skill? A, mouth care, B, denture care, or C, feeding. And the correct answer is B, denture care. So if that's the one you guessed correct. So dentures come in a set of uppers and lowers for your CNA class, and for the state exam, you'll only be required to use one. Most of us use the uppers just because it has a little more surface area. It's kind of nice. We figure if you can do the uppers, then the lowers are a piece of cake because it's just one little U-shaped curve there. Um, so again, you only have to choose one, and most of the state exams tend to just have the uppers. If by chance you get a chance to choose, some people will probably choose the lowers because it's easier, but they're both pretty easy. So just know that this is what they look like. Okay. Question number 5. Can you name this skill supply? So your options are A, toothbrush, B, denture brush, or C, dental brush. So the correct answer is B, denture brush. So the denture brush looks a lot like a toothbrush, but it was created specifically for cleaning dentures. So as you can see, so the denture brush is a little shorter, has a shorter handle than a regular toothbrush, and it also has two sides. One side is flat and wide, kind of like a regular toothbrush, and then the other side has a pointy side, and that helps you to get into the little crevices of the dentures. So with those dentures, if you flip them over, you'll see it has kind of a groove, kind of a U-shaped groove, and in that groove, sometimes it has, food in them from when they have the dentures in their mouth, and sometimes food gets, sorry, gets between the palate of the dentures in the person's mouth. And then also, if their resident is using denture grip or poly grip or some kind of adhesive to keep the dentures in throughout the day, sometimes there'll be a little residue left from that. So that little pointy tip allows you to get all of that out as much as you can. Sometimes it's a little bit that just, no matter how much you scrub, it won't come out, but it'll help you get the most of it out, and that helps to decrease the risk of bacteria buildup. You don't want your patient to end up having dental infection because the dentures weren't cleaned properly. So just make sure we utilize that. And if for some reason they don't have denture brushes available and you have to use a regular toothbrush, the process is the same. You just clean all of that area, clean all of the peak parts, clean all of the grooves and crevices, and brush the teeth really good, and then rinse them off. That way your resident has a nice fresh mouth and nice fresh teeth. Question number 6. This supply is a long, thin, flexible tube that's inserted into the bladder to drain urine. So your three options are A, catheter, B, bladder tube, or C, flex tube. And the correct answer is A, catheter. So you may also hear the terms urinary catheter, indwelling catheter, or Foley catheter. These catheters are usually soft and flexible. They usually stay inside of a person for quite a while. We also have something called a straight cath, which we mostly use if we have to get a urine sample, or if a person just has to have their bladder relieved every few hours because they're not able to do it on their own. But these particular catheters, which are the ones you will see in class and at the state exam, these are the more flexible catheters most commonly seen. Um, just know that when you're doing your catheter care, you want to be very careful. As you see, this tubing is very skinny, but if you look at the picture in the lower left-hand corner, you'll see that there's a bulb filled. Looks like a little balloon. So once the nurse or doctor, whoever puts this catheter in, once they put it in, we fill that bulb with water. And what that does is it keeps the catheter from coming out once inserted. So if you accidentally pull or position the patient to where there's tension on this catheter and the catheter is pulled out, this whole bulb is going to come out through the urethra. The urethra is not a big hole. As you can see how narrow this catheter is, that's about the size of the urethra. So if you pull on it, put tension on it, and the catheter comes out with the bulb, you're pulling that big balloon through a very small hole, which of course is going to cause a bit of trauma. You may have some bleeding, you may have some pain with that. So you want to be very careful, which is why when we teach you catheter care, we have you to support the catheter at the urethra with your fingers, and that helps you to not put tension on that catheter when you're cleaning it. And just be very careful when you're repositioning someone, just to make sure it doesn't come out. It doesn't feel good. I'm sure it doesn't feel good when you have a bulb that big coming through such a tiny hole. Question number 7. This supply collects the urine that's drained from the bladder. The three options are A, collection bag, B, catheter bag, or C, urine bag. The correct answer is B, catheter bag. So the catheter bag is attached to the catheter tube. And if you recall the previous question, we talked about the catheter tube. The catheter tube is inserted directly into the bladder. So when the urine comes from the bladder through the tube, it goes down into the catheter bag, and the catheter bag collects it. We always want to make sure that bag is drained throughout the day. If you're doing INO, you want to make sure you report the amount of urine collected to the nurse. If the urine looks like it has blood or pus or dark brown, anything like that, make sure you report that to the nurse as well. We want to make sure that that bag never touches the floor. The floor is always considered contaminated, so we always want to find a little hook. There's usually some kind of little hook or a hole or something like that where we can hang that catheter bag on the side of the bed. We want to make sure the tubing is always up on the bed. It should never be touching the floor, should never be below the bag. Otherwise, we have that gravity. So it's going in an unnatural position. If you're turning and reposition your resident, make sure you grab that bag, unhook it, and literally take the bag with you in the direction that you're going to be turning that resident. If the resident is getting into a wheelchair, then you just do the same thing. Just take the bag with you, and then we just hang the bag on the side of the wheelchair. That way, wherever the resident goes, the bag is with them. Obviously, it's connected to the resident, so they pretty much have to stay together. We have something called a dignity bag, and it's usually just a bag that goes, a cloth bag that goes over the catheter bag. Sometimes it's just a plain color, like maybe a dark blue or a black, or sometimes you may see cute ones with patterns. And that's so when the resident is out in the hallway in the common area, people are not watching their we're not looking at them, not looking at the urine coming through the bag. They're paying attention to the person. We want to make sure that we always grant them that. And again, if the urine looks funny, report it to the nurse. If the urine is a dark color, if it's got blood in it, if it's got pus in it, if it has a foul odor, if you realize that you're going throughout your shift and that bag is not filling up, I'll report all of that to the nurse. We just need to make sure that everything is functioning the way that it should to be effective. Question number 8. This supply is primarily used by men who are unable to take themselves to the bathroom. We have 3 options. Option A, a urine collector, B, beaker, or C, urinal. And the correct answer is C, urinal. So a urinal is a graduated cylinder, which means it also has measurement increments on there. It has ounces, it has cc's, pretty much like a beaker does. So once you collect the urine, if the patient is on INO, we can go ahead and measure the urine. Always remember, sitting on a flat surface, squat down to eye level so you can get an accurate reading. Um, a lot of the residents can do these on their own, not read them out, but they can use the urinal on their own. So sometimes they'll have the urinal, if they're alert enough, that you'll see the urinal that's on their bedside table. And they'll usually just turn their call light on when they're ready for it to be empty. Then you empty it, you rinse it, and you put it back on the table, and they'll use it again when they're ready. And then when they want you to come empty it, they'll turn the call light on. So a lot of times that's how that works. Some residents may actually need your assistance to place the urinal in the correct placement area. And then some residents are totally and completely independent with it. So this all depends on your resident and what the care plan says. We just want to follow that care plan and make sure that the resident is able to eliminate as needed. Question number 9. This supply is used for both mouth care and denture care skills. Your 3 options are A, emesis basin, B, spit bowl, or C, kidney basin. The correct answer is A, emesis basin. So emesis means to vomit, and quite honestly, these little basins will definitely not handle anybody's vomit. We usually end up pulling a trash can over for that purposes. But we can use this to let the residents spit in when they brush their teeth. We can use it to store the toothbrush and toothpaste in. If we want to soak their fingernails, we can do nail care. Get all the dirt and other things from under their fingernails. We can soak their nails in here with a little bit of lightly soapy water. So it can be used for many things, but just know it is called an emesis basin. And oddly enough, you may hear somebody call it kidney basin just because it's kind of shaped like a kidney bean. Number 10, this supply is found on the food tray and identifies essential resident information. Your 3 options are A, tray card, B, diet card, or C, both. The correct answer is C, both. So the diet card is found on the resident's food tray, and as you can see, It identifies lots of information, including the resident's name, any allergies, their prescribed diet, if they're on a cardiac diet, if they have low sodium, and it says no salt packages, no, the resident doesn't have any allergies. So if the instructions say no salt packages and you actually receive the tray with salt packages on it, just go ahead and remove those packages. Don't just assume that because they're there they can have it. Sometimes in the kitchen, they do it kind of like an assembly line. And so they just put sugar and salt on every tray. So if they accidentally do that, especially with new staff, they're trying to learn their way. So if they accidentally do that, just go ahead and take the salt packages off and put them off to the side. This resident happens to be on nectar thick liquids. Nectar actually is thin enough to go through a straw, but usually if a resident is put on some kind of a thickened liquid, that means that there's some deficits in the tongue and swallowing control. So if you put a straw there, it's going to make that liquid go bypass the tongue, go straight down the throat, which increases that resident's risk of choking. So if a resident is on any kind of a thickened liquid, you want to make sure that they do not use a straw unless otherwise indicated by a doctor's order or a speech therapist. So again, if you receive that tray, the card says no straw. You receive a tray that has a straw on it, just take the straw off and move it to the side. Don't just assume they can have it. If the instructions say do not give, then please do not give. So just kind of pay attention to this card. Make sure you have the correct resident. Make sure the information is up to date, and make sure the food that's on the tray coincides with what this card says. That way, the resident is kept safe. Number 11. This is the main supply for the feeds a client who cannot feed self skill. You have three options: A, food tray; B, serving tray; or C, snack tray. And the correct answer is A, food tray. So as per the previous section where we talked about the diet card, so always double check that diet card to make sure you have the right resident, make sure you have the right diet. So if your resident is on a special diet, set on a puree diet, but they end up with a tray that looks like this. Nothing on here meets that puree diet actually except for the mashed potatoes, and the mashed potatoes will actually not be as thick. So this whole tray would have to go back to the kitchen. We don't want to go down with a nasty attitude because everybody makes mistakes, right? So just go back and with the diet card in hand and say, "Hey, Mr. Johnson is supposed to have puree diet. I got the wrong tray." And they'll say, "Oh, I'm so sorry." You give them that tray, they will fix you a brand new tray with pureed food on it, and you just take that food back over and go ahead and set that resident up. So again, just make sure that you check that diet card, make sure that you have the right resident, and make sure you have the right diet. And it's totally okay. We all make mistakes. So just make sure we correct that mistake, keep the resident safe, and keep your liability down. And this concludes part one of the CNA Skills Supplies review. Don't forget to check out my CNA test prep activity books on Amazon. You will find the link in the comments as well as the description below. Please like, share, and subscribe if you enjoyed this video. Thanks for watching.